family has recently moved from Nebraska to Texas. Visits pediatrician. They have 3-year-old boy who has been developing normally before this change in location. 3 months after moving into new house, he became lethargic, fatigued, pale, and constipated. A peripheral blood smear shows sideroblast. Analyze the scheme present in the picture. Which of the following enzyme labeled as number 1 is impaired in this patient and contributing to his symptoms? So basically, this is a boy who has moved from different city and is visiting pediatrician. Now he is complaining of lethargy, fatigue, pain, and constipation. What they're asking is which enzyme is affected in this patient's condition. So, so they have pointed out already that enzyme 1 is affected in patient's condition. What they want you to tell is what is the name of enzyme 1 over here. So options are ribonuclease, ferrochelatase, ALA oxidase, uroporphyrinogen decarboxylase, and uroporphyrin 1. So this patient is having lead poisoning. Now we have to understand that they are asking that which enzymes are affected in lead poisoning. So there are 3 enzymes that are affected in lead poisoning. Number 1 is ribonuclease. Second is ALA dehydrogenase. ALA dehydrogenase, ALAD. And the last is ferrochelatase. Now in this question they're specifically asking what is enzyme number 1, okay, in this figure labeled as number 1. They're asking which enzyme is affected, which is labeled as 1. So there are 3 enzymes that are affected or that are dysfunctional in lead poisoning, and they're asking which enzyme is enzyme number 1. So ferrochelatase is the enzyme which is located at position 1. So what ferrochelatase does is it basically the substrate here is iron. It puts iron in protoporphyrin and makes heme. So if ferrochelatase is affected, what will happen is iron will start getting accumulated. Iron will not enter in heme, and it will start getting accumulated in mitochondria. And when you see sideroblast or in fact basophilic stippling, so this basophilic stippling is actually labeling the iron that has accumulated in this mitochondria. So that is actually basophilic stippling. The accumulated iron picks up the stain and that leads to basophilic stippling. If you can see here the blue dots, so the iron that has been deposited in the mitochondria due to deficiency of ferrochelatase enzyme are getting picked up by the stain, and that is known as basophilic stippling. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.